Thank you. Thank you, everybody. Leading up to this, I've kind of felt like I was back in 6th grade giving my tiger shark presentation in front of my science class. Only this time I actually prepared for it, so it'll be a much better experience. So yeah, my name is Tom DeLegro. Please invite you all to look me up on LinkedIn. It'd be great to connect with so many of you on that platform. Before I get into my company and actually what I do, I want to have a little audience interaction. I'll do this a couple of times here as we go forward. So just kind of an intro into what I do. By a show of hands, you see the question on here. How many of you, if you could put your hand up, are frustrated by the cost of medical insurance? 2 hands, okay. Yeah, me too. Pertinent as we head towards January 1st here. You'll see it all over the news. So again, another question. Have you ever received an outrageous medical bill? Keep your hands up. Yes, there's a lot of you. Okay, so that is the environment that I've decided to start my business. What I do is, again, my name is Tom DeLegro. I'm the founder of Benefit Advisors of Charleston. I help company owners and CEOs in conjunction with their HR and finance teams implement more attractive and affordable medical plans so they can actually retain and attract new employees and lower their costs each month. So sounds great and exciting, I know, but why would anybody have a desire to get into that? Well, if you can read this quote here from Richard Branson, clients do not come first, employees come first. If you take care of your employees, they will take care of your clients. Guys, I believe this, like really believe this. And I believe it applies to anything, business, family, sports teams. You take care of your people and they take care of you, okay? And this has a personal context for me. I lived this. So my dad, when I was a kid, had a terminal disease. He had a group medical plan available to him through his employer. He was given affordable access to world-class healthcare in and around Boston. When he couldn't work anymore, he had long-term disability, which kept us fed and a roof over our house. And when he ultimately passed, we had a group life insurance policy that actually kept us afloat, allowed me to go to college. So from a philosophical and a practical personal standpoint, like this matters to me. And the reason why I started my business is I'm questioning, given today's environment, whether this is even still possible. Now, I'm not suggesting that only insurance does a good HR and benefit program make, but it's a pretty big piece of it. And my goal is to make sure that it can still be accomplished. Okay, another trivia question for you. Anybody care to guess by what percentage employer-sponsored medical insurance has increased since 1999? Throw out some numbers.
200.
200 is exactly right. Man, that's good.
Where's the healthcare?
200%. The rate of increase doubles every 8 years. Now think about that. In 1999, it wasn't exactly cheap. Okay, so we're talking 200% of an already high number back then, and this shows no signs of slowing down, right? So if you wonder what 8-year pay raise for the middle class America, you can look right here at health insurance and healthcare costs. So what we look at is the fact that, in cases been made for this, that healthcare has stolen the American dream. It's eroded the middle class. If anybody has a younger generation, you wonder why they have, so pessimistic about their earnings potential. An argument can be made, and has been made in this book right here, The CEO's Guide to Restoring the American Dream, that is in fact what's going on. So that book is written by Dave Chase, a mentor and a friend of mine. It makes that exact case, and it's very compelling. We can argue that, but that's the argument that he makes. And not only does he make that argument in that book, but they also give a path forward and how to deal with that, and how advisors can help employers bend that curve and actually make a positive impact. So that's where I come in. This is the foundational playbook by which I operate my business. And in this book, he outlines what's called the Health Rosetta. Now, the Health Rosetta is fair trade coffee. It's the diamond brokers who broker diamonds that are not blood diamonds. It's a Wikipedia of best practices from employers that have figured it out from around the country. So as a Health Rosetta broker, or an advisor, not a broker, we implement these strategies to the various businesses that we encounter in our own local communities, and we are mission driven to promote these strategies, some insurance, some not, to address the rising and unaffordable costs when it comes to group health insurance. Competing against that is a $3.3 trillion industry. Healthcare is the largest employer recently became the largest employer in the country in this field. It is a huge business, and this industry, a lot of it exists to propagate the status quo. So what we try to do as Health Rosetta advisors in our own particular communities, take small steps to push back against this. Okay? How do we do that? We do the opposite. So in an industry that's fastly moving down the road of consolidation, we look at independent fiduciary solutions for employers. When pharmaceutical prices domestically are becoming quickly unaffordable, we look to international sourcing for pharmaceuticals. When provider networks are getting larger and larger, we look at eliminating or reducing the scope of a provider network, right? All to push back against that status quo $3.3 trillion train, okay? So how do we do that? We follow these primary fundamentals. When we encounter an employer group who's struggling with these costs, we put extreme emphasis on primary care. Now, just because something is not covered by insurance does not mean you cannot get it. And oftentimes when it's not covered by insurance, it often becomes cheaper. And that includes primary care. One of the foundational principles is something that's called direct primary care, in which a primary care doctor does not take any insurance. Not Medicare, not Medicaid, not any private insurance. Pretty much if you're willing to pay cash or any form of payment, that doctor will service you as an individual or your employer group. So what does that mean? Well, the current model, often some of you might know the fee-for-service model, physicians are paid based on the number of people they actually see in the day. That translates into 10 to 15-minute doctor visits, and we wonder why people are going to high-cost facilities, seeing high-cost specialists, and getting basic care being overlooked. They're just not getting the time in front of a primary caretaker that knows them and their families, okay? So we put a heavy emphasis on that, and there's a growing cadre of physicians that are actually adopting that model. The second is transparency. I don't know if you've noticed by the hands gone up, when you got those high cost bills, did you ever know why? Pretty much just got a number, right? So the second thing we emphasize is transparency. Transparency in billing, transparency with me, as an advisor, how much I get paid. It's not often disclosed what your advisor might be getting paid when you're working with a legacy broker. So that starts with us. It translates into your billing. It translates into what you're paying for prescriptions, what your vendor's making off of the solutions they're providing you. Payment integrity. This is a big one. The legacy industry has bragged about the fact that they pay, or it's called auto-adjudicate, over 90% of medical claims. Okay, that's great for efficiency. Are you aware that 90% of hospital bills actually have errors in them? So they're automatically paying hospital bills that have errors in them, leading to a lot of fraud and waste. Okay, and I put it in quotes because you notice those hospital bills are never in your favor. They're always overages to the hospital, right? So payment integrity is essential to keeping costs in control. And then lastly, concierge services. Concierge services is essentially your Sherpa, the person to hold your hand through this. Yeah, it is a different process that we implement. It is certainly not the easy button. It can be made to be easy with an effective concierge service, but with convenience comes disruption, and with disruption comes waste and greed. And so taking a step back on what typically has been the easy button, just handing over your insurance card, is putting us down the path to some of the cost issues that we're seeing. So a concierge service is essential to some of the solutions that we bring to the market. So what does it look like when a fully operational Health Rosetta type plan with an effective fundamentals are put in place? And you see it here, and there are several examples of this around the country. Mr. Rosen, Hal Rosen, owns Rosen Hotels and Resorts in Orlando, Florida. He's a Hungarian immigrant, bought a poor-performing hotel back in the 70s, grew it, and in the mid-90s, he got frustrated with the current state of what he was paying for his employees' healthcare costs. So he took the bull by the horns, literally, and took control of what his company was actually doing for employees. And I gave the fundamentals earlier of the primary care, concierge, transparency, and payment integrity. He refers to it as his 3 C's. 3 C's are cost, care team, and community. So when he adopted those 3 C's, he ended up spending 55% less on healthcare, saving $240 million over 24 years. There's your cost. He experienced 10 times employee growth and 83% lower turnover than the industry average. And those of you in the hospitality industry, that's pretty impressive. The third C, community. Your zip code, I'm not going to say is as important, but it's pretty close to being as important as your genetic code in terms of your health status and your health outcomes. So Mr. Rosen, recognizing that, used some of that savings and invested $11 million in community programs, reducing crime in that area by 67% and raising the high school graduation rate in that community. He pays for college tuition for his employees and their children. So he fully adopted the community aspect to help his healthcare spend. Now, do you think he has any trouble attracting new employees? No. So this is kind of a model, and the solutions are out there. And again, he is not the only one. They just need to be scaled, and that's, again, the foundation of my business and what I'm trying to do. Okay, so how, as a community, I was asked to see how you could possibly help me. So what I would ask is for you guys to just keep your ears open to who might be frustrated with this. Again, the industry is very antithetical to the things that we just talked about. And so anybody that's frustrated, we just ask that you guys keep your eyes and ears open and communicate the message that there are solutions out there. They just, like I said, need to be scaled. And any introduction that you could possibly make to any sort of decision makers or anybody who might have a contact with the business who could benefit from these approaches would be greatly appreciated. So that's me, and again, look forward to connecting with you all both today and on LinkedIn.
All right. Great job, Tom. All right, so Q&A, we've already got hands up. All right, I've got one. I'll come to you next. Make sure to introduce yourself and speak directly into the microphone.
Hi, Rory Cathcart. I just wanted to ask, what is your ideal client size for this type of product?
Yeah, I get that a lot, and the people look at it and they say, oh, it's only 50 employees, or ideally it's 100 employees. I adopt some, obviously on a larger employer, there's more ability to do some of these more innovative things. But I try not to discriminate. I try to help any employer that's frustrated and needs to keep their employees and wants to embrace their employees and keep them around via important health benefits. So, ideal client size is probably minimum 30 employees, but I will happily help anybody who has 5, 10, 15.
Good morning, Whitney McDuff. Great presentation.
Thank you.
If we were able to connect you with a decision maker, what does that onboarding process look like for them so that we can help prep them for what's coming down the pipeline?
Yeah, I just try to ask as many questions as possible to find out what they actually want to accomplish. The trend in my business, the advisor and broker community, has typically been to go out and just get a bunch of options, put them on a spreadsheet, and I take a very different approach. I lead in with a lot of questions, find out what their goals are, where they want to go, and then design a plan accordingly along the lines of the fundamentals that I mentioned earlier in the presentation. So if they can bear a bunch of background questions, then that's pretty much the lead in.
Right here, Tom.
Hey, Frank.
Frank Wells, Health First, and Renew's self-pay only clinic on King Street, and Health First is a bunch of insurance. So the question is about the MEC, minimal essential coverage. So far, that federal mandate has kind of required people with 50 employees or more to buy wellness coverage. We all know that wellness healthcare coverage costs about 10 times what a catastrophic or hospital surgical plan would cost. So we're paying a lot of money into that. And even when you use your insurance, you're still paying more than a self-pay cost for your visit, even with your insurance premium. So how do we address the MEC? How do we get around the MEC, the minimal essential coverage, so that employers can buy catastrophic care for their employees instead of the wellness care and save 90%, put it into HSAs for the employees, pay for college tuition? How did Rosen do that and avoid the federal regulatory requirement of minimal essential coverage?
Yeah, so the minimal essential coverage, you have to hit 63 benefits mandated by the federal government. That's part of your medical plan. So to get a plan that covers that, I mean, anybody that has a group health plan that has a certain actuarial value, you're going to hit that MEC requirement just by the plan design. Alternatively, you could certainly buy something to check that box, but again, that is a minimum requirement that's fairly ineffective that you would then build on and add other benefits. And now, again, what I'm saying is we can provide benefits. It doesn't necessarily mean you have to provide insurance, and that's where we connect people to bundled surgery procedures, direct primary care, and everything else that's outside of the insurance landscape. In terms of HSAs, now I agree with HSAs from a tax savings perspective, but I think it's one of the most cruel things we've ever perpetrated on the American worker.
Can you just explain what that is for people that don't know?
Health savings accounts. So we've mentioned how we can put money into health savings account is a tax advantaged healthcare account where you can shelter money that can only be used for healthcare expenses during your working years. Okay? And as part of that, the give back is the IRS says, well, you have to have a high deductible health plan. Now, conceptually, that's fine, but we have a situation in this country where the average American worker has a health insurance deductible of only $1,000, and about half the country doesn't have $1,000 in their bank account. So essentially, they're functionally insured. They have insurance that they can't use. They're a stub toe away from financial ruin. So although I agree with the tax benefits of an HSA, I'm not a huge advocate of the HSA concept. The actual way to reduce healthcare costs is for an employer to improve benefits and remove access to primary care, remove financial barriers to generic drugs, provide free or low-cost diabetic medication. You got me going now, Frank, I'm sorry. Take a diabetic, for example, okay? A surgeon or a hospital system is reimbursed $22,000 an hour to amputate a diabetic's foot. You know what a primary care provider gets reimbursed on average for treating a diabetic and actually caring for that patient in coaching, diet, proper adherence to medication? $26 an hour. That's backwards, folks, right? And so I go back to the slide of Mr. Rosen. He actually brings on and pays for primary care for all his employees to avoid that conundrum that the system is imposing on employees. So, and that just initial thought, I'm not a big fan of HSAs because they actually remove and place financial barriers to getting that basic access to primary care.
Hello, my name is Thomas Heath. I'm one of the community organizers here at 1 Million Cups Charleston. So first of all, great job, man, because I know this does not come naturally to you, presenting in front of people, especially while someone is fixing a broken window next to you.
I'm actually thankful for that, because if this went sideways, that's way more interesting.
Okay, well, you're getting a breeze.
They took a broken window out of there without losing it anyway.
So, thumbs up on the presentation. It was succinct. You involved some humor. You got crowd engagement. Love that. I'd almost love to see a tagline that involves the word disruption. You know, we are disrupting employee benefits plans or something like that, because I feel you have a disruptive element to what you're doing. A lot of you have heard me say, I'm a business coach, so I say to my clients, ask yourself 3 things. Who are my peeps? Where do I find them? What do I say to them? So geared towards helping you, you said you'd like introductions. Give us 3 industries that we can plant in our minds, which would be good fits for your service offerings.
Sure, thank you. And on the subject of taglines, you know somebody that could possibly help me?
Possibly.
Okay.
I don't know. He's a pain in the neck.
Yeah, so for my solution, the strategies I propose, what I'm looking for are higher than average salary with lower than average margin. So that puts me in the transportation logistics industry. That puts me in the architecture and design niche. That puts me in the skilled trades niche as well. So that would be those would be the 3
Okay,
categories.
so support, so the port,
Yeah.
South Carolina Maritime Association is a great place for you. Port, logistics, warehousing, distribution, construction
Manufacturing.
trades, small manufacturing,
Yep.
great.
Yep.
And then what do you want us to say to them? So, who are your peeps? Where do you find them? What do you say to them? Okay, so this guy, you got to meet Tom because he will help you reduce your cost for employee benefits while increasing your talent attraction and retention. And you do that how? Fill in that blank. You do that how? Give us that soundbite.
I provide value. So when you see you're introduced to an employer who's just smart and frustrated, smart and almost desperate to, God, I gotta do this. People want, especially in this tight labor market, we gotta have something to attract and retain that's valuable, not the run of the mill. My ask would be, hey, I got a guy who could possibly help you. So I want to be the guy to solve that problem, that frustrated, stressed out employer who's looking to set themselves apart and be, essentially what I help them do is be an employer of choice in their market, however they define that.
All right, who has a question? All right, coming.
So Thomas, I'm going to disagree on going in directly with value or with reduction in cost, right? So Tom, you and I have talked a little bit, but from my line of industry, going in with providing a cost savings right off the bat isn't always necessarily something good, right? Because not everyone's always looking to save money. They might just be looking for something to improve, say, employee efficiency, attract employees, but it might not be cost related right off the bat. So, maybe trying to find a way to make people understand what you do a little bit better, as far as going in and just trying to understand that pain point, and then kind of bringing it from there, just talking about your value and different things that you can provide, rather than going in directly with, hey, I can save you money. Because again, it's not always about how much it costs per month, but it's everything else that you can provide that more is the value for it. So,
Thank you. And I think the cost savings is a byproduct of kind of the solutions that I put in. So yeah, valuable input. Thank you.
Oh, who's next? Sorry, I thought that was going to be a longer answer, and I'm trying to refill the coffee so no one gets aggravated. All right.
I can keep talking if you want.
No, we're good. All right. Who's next? All right, cool.
Hey, Tom, good presentation. What I'm seeing is you're talking about benefits, but in hearing what a couple of other people are saying, it's not just the benefits the employees receive, it's how the company itself is benefiting from the services that you're bringing. Because we all know, business owners, we know that hiring and training and replacing employees can end up costing a lot more. So it's maybe you focusing on how it benefits the company as an advisor also, because it's not just about cost. As a business owner, employee retention is so important, and you need to be able to do the things to keep employees happy and to keep them, because the last thing we want to do is have just a revolving door. So speaking also, not just the benefits of the medical end, but how it benefits a business owner.
Right, thank you. And I often use this line, to what you're speaking to is a company's culture. Insurance doesn't help retain employees. Benefits in general don't help retain. It's the company culture that those benefits fit in. So the culture is the water you breathe, the water you drink and the air you breathe. The benefits are washing your hands, brushing your teeth, right? So it's all part of that same kind of approach to ultimately keep that costly turnover down. So thank you, I appreciate that input.
All right, we have time for a few more. Anyone? All right, John.
I could probably do it without the microphone, but hang on. Big mouth, sorry. John Stroud. At what point does what you're doing, because I'm guessing that the insurance companies could do this. There's some incentive not to do it, which I'm assuming is profits. But they could also offer similar plans, I'm guessing. At what point does there become a tipping point of you making this offer where insurance companies come back in and say, well, we can make the same offer?
Yeah,
or is that not possible?
Yeah, so the insurance companies are actually, how do they make money? Premiums. And they don't make less money if they lower their premium, obviously. They are actually incentivized to keep premiums going up. And very little of what they're doing is actually looking to reduce premiums. If they reduce premiums, they reduce their profit margin.
They don't want direct provider care models. They don't want direct pay models.
Right, and so who is an insurance company's customer? It's not you guys, it's not us, it's not employers. Their customers are the health systems and the doctors. And I'll give you an example. A friend of mine, we were having a conversation with a top level executive at a company locally who has a color in their name. And we had asked them, we have a relationship with the Surgery Center of Oklahoma, and I suggest you guys look them up. Surgery Center of Oklahoma posts all their prices for all their surgeries online. They've had 2 price adjustments and both have been down. And they don't take any insurance, not Medicare, not Medicaid, and not private insurance. So when we asked this executive, would you take, if somebody went to the Surgery Center of Oklahoma for an inguinal hernia operation, let's say, the cash price locally here, non-insurance, range from $8,000 to $47,000. This is up around the Rock Hill area, okay? At the Surgery Center of Oklahoma, it was $3,200 all in. Not only that, but the provider, the surgeon at the Surgery Center of Oklahoma made $1,200 versus what they make here locally through an insurance arrangement. They make $800. We said to that executive, would you give them credit towards their deductible if you paid cash and applied that to their health insurance deductible? They said no, and we said why? And she couldn't answer. And we said, I'll tell you why, because your customers are not the public. Your customers are the hospital systems and providers. So they might try, but they'll never do it because they have a competing interest.
Adam Doan with MACTO Business Alliance. We're talking about who's the best person to put you in contact with, and maybe dive in a little bit more on that one. Would you rather talk to somebody in HR or more of a CEO, CFO? Which person should we go to first, or would you rather have all of them at the same table?
Very good question, and I struggle with that because HR is charged by the ultimate decision makers to do 2 things. 1, keep the employees happy, and 2, not to get us sued. And also they're ultimately tasked with handling this type of things, HR and benefits. First, it's conventional wisdom and the industry etiquette is to be put first in touch with HR, but ultimately this has to be a business owner and CEO or CFO level participation in the decision.
All right, well, time for one more question. Anybody? Anyone? Taylor?
They're dying to hammer home here, so I think we should.
All right, well, I will ask the final question.
Great.
And I know you've already talked about a little bit and had your slide on ways we can support you. But number one thing that you would ask It could be not, what was something that was not on your slide, but what is something that you'd like to ask of the room? Number one way that we can help you.
Okay, number one thing, a lot of this scares people. So if anybody has any advice or feedback on how this can be presented to be less scary to a business owner, anybody that wants to come up and let me know, that would be great, because it is certainly different and not status quo.
Awesome. All right, let's give it up one more time for Tom.